The Navy is enlisting a new tool to help sailors experiencing mental health issues. It is rolling out a new mental health playbook designed to facilitate conversations with commanders taking the lead. And the overall goal is to break the stigma of seeking help in the first place. The Navy says its health technicians and psychologists are overwhelmed, and there is a backlog of appointments on deck. So here's what it encourages leaders to do. Set conditions to create a climate of trust and open two-way communication. Recognize mental health issues by encouraging leaders to use empathy and get people the care they need to keep them on the team. According to the Navy, 70 sailors died by suicide in 2022. That is an increase from 59 suicides in 2021 and 65 in 2020. The hope is that resources in the playbook will help leaders flag suicide-related behaviors before it's too late. Let's bring in retired Lieutenant Commander Stephen Rogers, who worked with the Office of Naval Intelligence. Thank you for joining us, sir.
My pleasure to be here. Thank you.
I find this interesting. I'm a civilian. I've never, no military service here, but the idea of a two-way conversation between a subordinate and a commander, it just strikes me as that's kind of not the way things work. But the Navy kind of wants it to work that way, at least when it comes to mental health.
Well, look, you're absolutely right. Look, any effort to address mental health issues in the military is commendable. However, you're asking a lower-ranking individual to go to his or her commanding officer and to share perhaps some intimate personal issues that that sailor's dealing with. Now, here's the problem I see. You're asking, meaning the military, the Navy in this case, is asking commanding officers to diagnose whether an individual has a mental health problem or not. And it's just another layer that this sailor has to go through in order to find the person who can really help them. So I would say this is an unnecessary burden on the sailor to begin with that was seeking help, and the commanding officer. It's not his or her job as a commanding officer to diagnose whether an individual has a mental health issue or not.
What about the idea, though, that maintaining a healthy fighting force for the Navy is incredibly important, and part of that is mental health? And if the commander isn't taking care of his subordinates' mental health, then he's not going to have a healthy fighting force, and his unit's not going to be what it needs to be.
Well, look, it should be detected, if you will, if there's an individual that has perhaps a mental health issue dealing with on the lower ranks. You have your non-commissioned officers, your immediate supervisors. Look, I was in the military for 25 years. I was a commanding officer. If I thought someone who I was supervising did have an issue that they would have to deal with regarding their mental health, certainly I would contact someone to reach out to them. But to ask that individual to speak to me about their problems, I'm not qualified. I'm not a mental health therapist. I couldn't begin to tell you if someone is going down a road that's hurting their capability to work due to mental health. But there are resources in the military, and that's our chaplains, that's our therapists. The issue, as you articulated in your opening, is the fact that the military needs to invest more manpower in the mental health field. Get the doctors there, get the therapists there. By all means, we have the funding in the military to do that. In other words, let the professionals handle mental health issues, but at an early stage. Let me tell you,
and if there aren't enough professionals, then get more professionals, right?
Well, yeah, they can do that. Look, by the time it gets to the commanding officer, it could be a full-blown problem.
Well, let me ask you this before.
It doesn't start overnight. It starts perhaps sometime before that sailor reaches the command force level.
Last question to you then. Are we taking our eye off the ball here? I know you were saying that this is not the responsibility of a commanding officer. It's even tougher for somebody who's a subordinate to go up to a commanding officer and tell him or her these things. But are we taking our eye off the ball? Is the focus on mental health actually going to make America less safe because we're not focused enough on the protection of the United States?
Well, look, we have to be focused on the protection of the United States. The job of a commanding officer is to ensure that his or her troops are combat ready, able to defeat an enemy at any time, anywhere on the face of this earth. So our resources on the command level need to be on warfighting, on beating an enemy in the event we end up in a war with an enemy. Let the mental health technicians and experts deal with that.
All right. That is Lieutenant Commander Stephen Rogers. Thank you so much for joining us today.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.